Most people think they know whether drinking alcohol is good or bad for their heart. Maybe you've heard that a glass of red wine is good for you, but is that really true? Here's the reality. For some people, alcohol, even in small amounts, can quietly raise their blood pressure, affect heart rhythms, and add hidden risks they never saw coming. And here's the surprising part. There's one piece of evidence about drinking and heart disease that you almost never hear. And I'm going to share that critical fact with you at the very end of this video. You'll never look at that glass the same way again. First, where did this idea even come from? Well, it's called the French paradox. Decades ago, researchers noticed that people in certain parts of France had lower rates of heart disease, despite eating more butter and cheese than people in other countries. Some thought red wine might help explain this, because it contains compounds called polyphenols, which have antioxidants. But more recent research shows the story isn't so simple. People who drink moderately often have healthier diets overall, walk more, and have strong social networks, all of which protect the heart. So the wine itself may only be a part of the picture, if at all. Physiologically, here's what happens. When you drink alcohol, it's absorbed quickly into your bloodstream. In small amounts, it can temporarily relax blood vessels. That's why people feel a mild calming effect. But over time, regular alcohol use can do the opposite. Can actually raise your blood pressure, increase certain blood fats called triglycerides, and force your heart to work harder. Heavy long-term drinking is well known to have a weakening effect on the heart muscle. It's what we call alcoholic cardiomyopathy, which can lead to congestive heart failure. Even moderate drinking can increase the risk of developing an irregular heart rhythm, especially atrial fibrillation. And that's really important because atrial fibrillation raises your risk of having a stroke. This surprises a lot of people. You don't have to drink heavily for alcohol to have a negative effect. Strong research shows that even low and moderate drinking, say just a few drinks per week, can cause a small but measurable rise in blood pressure over time. So while small amounts might not be dangerous for everyone, they're not always harmless either, especially if you already have high blood pressure or other risk factors like diabetes and heart disease. Who needs to be most careful? If you have high blood pressure, a history of stroke, heart failure, or a condition like atrial fibrillation, alcohol can push those problems further. It can also interfere with medications for high blood pressure or blood thinners. So if you take these, talk to your doctor about whether it's safe to drink at all. Patients always ask me, Dr. Chuback, does this mean that I have to quit drinking altogether? The answer is, really, it depends. For some people, yes. If you have heart failure or atrial fibrillation, quitting or cutting back sharply may be the best thing and could potentially really help your heart. For others, a small amount like one glass of wine here and there might be reasonable. But here's what every major heart health group says. No one should start drinking just to protect their heart because the protective effect is not strong enough to outweigh other health risks. There are proven ways to protect your heart that work better than any wine glass. 1, eat more fruits and vegetables. 2, limit processed foods and sugar. 3, stay physically active. 4, keep your blood pressure and cholesterol under control. 5, get enough sleep. And 6, if you smoke, quit. That change alone does far more than any other supposed heart benefit from alcohol. All right, here's that one piece of evidence you rarely hear. The latest large-scale studies show that when it comes to heart health and cancer risk, there's no clear, safe level of alcohol for everyone. Even when you have just a drink a day, this can slightly raise your risk of certain cancers and irregular heart rhythms. And the risk increases the more you drink. So while moderate drinking may not be dangerous for everyone, there's no guarantee that it's truly protective either. Hey, if this video helped you rethink about alcohol and how it fits into your heart health program, please share it with someone you care about. Drop your questions or experience in the comments. I read every single one. Don't forget to like and subscribe for clear, practical medical information you can trust. Thanks for watching, and I'll see you in the next one.